Every story this week has really been a variation on one theme, that infectious disease is the default state of the world. I've said that multiple times. I wrote something about that. You have to recognize that the only thing that holds back many of these infectious diseases is a system of people, laboratories, inspectors, vaccines that have to be funded, staffed, and trusted. When that watch, those sentinels, those sentries are present, outbreaks get contained. They get minimized. When they're thinned or politicized, the pathogens do exactly what they've always done. These are the barbarians at the gate. They've never left the gate. This week we had a foodborne outbreak solved only after it already spread. An Ebola epidemic outrunning its response and continuing to outrun its response. A record measles year. A fight over who is going to run health agencies. And maybe as a counterpoint, one city quietly proving what a working system still looks like. So the biggest news story this week has been the Cyclospora outbreak. So we've had 3 weeks of climbing case counts with no identified vehicle. Now the source is clear. So this is likely the largest Cyclospora outbreak on record. More than 7,000 cases already, and it's going to continue to go up. Michigan appears to be the epicenter, and they were growing cases at 20 to 30% per day at their peak, and this is likely going to continue to accrue new cases maybe till August. The source is now clear. This is Taylor Farms. This is a California-based produce conglomerate, which has an independent grower relationship and processing facilities in Mexico. This is not new to Taylor Farms. They were involved in the 2013 Cyclospora outbreak, a 2024 E. coli onion outbreak that was tied to McDonald's. And so far, they've issued a recall. And one of the things that's interesting about this recall is that it's probably not getting everything. So they still quite don't understand what the level of contamination might be. This is a place that had been inspected by the FDA in the past. It was last inspected around 6 years ago. And then before that in 2011. Taco Bell seems to be hit hard, and I'll get to that in a second. The CDC has started to get more aggressive. They are talking to the press. They issued an HAN alert. And they're moving some states from monthly to weekly reporting. One of the things that keeps coming up is FoodNet, which is a system that the CDC uses to kind of survey and track foodborne outbreaks on a year-to-year basis. I think there had been justified speculation whether cuts in FoodNet, which kind of pared back what it was surveying to just Salmonella and E. coli, whether that had an impact. I don't think that's actually the easy fix, is not FoodNet. It's not FoodNet that probably played a role here. It's the fact that the CDC is understaffed, that health departments are understaffed, not getting all that they need, and they're unable to have the FDA is unable to have inspectors in certain plants, and it takes a while if you don't have much personnel to interview everybody, to do the interviews, which that's what you need to do to figure out exactly how a foodborne outbreak is spreading. There's a lot of home remedies for Cyclospora that are coming out, mainly with respect to washing. I think the bottom line is it's the mechanical scrubbing that removes the oocysts. Remember, these oocysts have a very robust cell wall. So when you hear about vinegar, all that kind of stuff, it's really unproven. It's probably the mechanics of scrubbing that play a role rather than what you're soaking it in. And remember, also, people talk about swimming pools. People are going into swimming pools. This isn't something that really spreads easy in swimming pools because the oocyst isn't infective. If somebody has an accident in the pool, those oocysts that they shed, they're not infective. So pools aren't really a major aspect of the transmission cycle, even though these are relatively resistant to chlorine. It's just that the oocysts are not ready to be able to infect people. People can get reinfected with Cyclospora. Reinfection can be common in certain situations. And looking at the case reports, age ranges around 5 to 88. I think it's important to remember that Cyclospora, not life-threatening, hospitalizations, and there's a hospitalization in my home county, are largely for dehydration. Fallout is starting to occur. There is a lawsuit that's been filed against Taco Bell. Taco Bell's stock price is down. Their foot traffic is down. On the contrary, Sweetgreen, which was not involved, their stock price is up. But remember, the lettuce wasn't probably just something in Taco Bell. It probably was in grocery store shelves as well. Now, moving to Ebola, which I think you should think of that this is a fast-moving outbreak that the response is not yet able to catch, and it's going to get slower now because there's self-defeating travel policies. Multiple provinces in the DRC. And what's most scary is 80% of cases are arising from unknown transmission chains, which means that they don't have any handle yet on this outbreak. And there's people estimating the true count is probably 2 to 4 times. It's already the third biggest Ebola outbreak in history, and it may continue to eclipse prior Ebola outbreaks. And as I said, the response is really outrun. We're finding deaths occurring in the community rather than Ebola treatment units. That rising case fatality rate tells you that beds and capacity are running short. People are getting sick and dying in the community, probably exposing other people who don't have PPE. What we're finding is there are major issues with the healthcare workforce. Healthcare workers have been striking. Some of them have been left without pay for 2 months. Even some are being held captive because there's so much violence there. Domestically, the U.S. has invoked Title 49, which basically makes anybody that was in the DRC within 21 days puts them on a no-fly list. I think this is counterproductive, and it's counterproductive by design. They are trying to kind of wed themselves to this idea that there are 0 Ebola cases in the United States. So they won't even allow people, Americans who are ill, to be treated in the United States very safely at Ebola treatment units that are designed for that. You have 7 Americans now stranded in Kenya in a quarantine center. This is not how you do it. And constitutional public health lawyers like Lawrence Gostin at Georgetown are talking about the fact that this is likely to fail Supreme Court scrutiny because you have to have an individualized risk standard. You can't just blanket say this based on the fact that they were in a country. And as I said, both Americans that were sick, one who is now back home, were evacuated to Germany rather than treated in U.S. treatment units. This basically allows these U.S. treatment units to lie fallow, treatment units that taxpayers spent a lot of money. Again, this is a political choice. There was an interesting article in Bloomberg by Jason Gale, the journalist, talking about the fact that there's this concept now that's starting to arise called walking Ebola. What does that mean? It means that people with this particular species of Ebola, Bundibugyo, are not that sick, so they can walk around with it. So that means people are getting exposed in areas if they're walking around with it because they don't have adequate testing. But it also offers an opportunity because if they're not that ill, that gives you a bigger window to use countermeasures like antivirals because maybe the viral load is still building up. It hasn't reached peak yet. So that's an interesting observation that people are making about this species of Ebola. And again, we don't know as much about it because this is only the 3rd outbreak of this species. And there has been major progress on countermeasures. The Oxford vaccine phase 1 is running in parallel in England and Uganda. The Serum Institute in India has already made 620,000 doses. And there is a post-exposure trial called EboPep, which is testing Gilead's new oral antiviral, obeldesivir. This is much, much faster than the 2014-2016 outbreaks, and that deserves to be kind of applauded. A couple of other things to watch. Uganda discharged its last Ebola patient and is now in its 42-day countdown period. But that's great with Ebola, but there's still a lot of opacity regarding the Marburg cases. And remember, Marburg is in the same family as Ebola. They've confirmed 1 case. There's some rumors about a 2nd case. But my understanding is that they're not complying with the WHO's international health regulation requests to get more information on the Marburg outbreak or cases that are occurring there. Moving now to measles. The United States is about to eclipse its 2025 case numbers, and it probably already has. We're just waiting to do the math. It's important to remember that measles is not a rash, and I'll talk about that in a second. So the national count is around 2,260 cases for the year. And just to remind you, we're in July. That was in December when we reached that number last year. Pennsylvania, my home state, is at a record. 109 cases have been confirmed, and I know there are more to come. I've been told that there are more to come. There's new cases in Idaho, including in a vaccinated person. Remember, the vaccine is very, very strong and robust, but not 100%. Maryland has 9 cases. Internationally, the UK has recorded the 3rd death this year in an immunocompromised adults, and Bangladesh is fighting a massive measles outbreak on top of a dengue surge. I think it's important to remember that measles is not just a benign rash-like illness. And I think it's really important also to make sure that when we're talking about outbreaks, we're talking about things like hospitalization. So Utah had put out some data on their hospitalized patients, including adults that were hospitalized for hypoxia, meaning their body was unable to oxygenate. Their lungs were unable to garner enough oxygen from the air because they were damaged to oxygenate the blood. South Carolina, which is this year's largest state outbreak, saw 2 encephalitis cases, one which had major deficits that were lasting, and 24 hospitalized patients developed secondary infections driven by measles immune amnesia. Remember, measles can erase the immunity that you have to other infections. So it's not surprising, but I think these numbers are important to put out there so people actually understand that what they're choosing is not a mild rash-like illness. One, it is a disease that has consequences and ends up putting people in hospitals. And there was a really good op-ed kind of highlighting this by Jessie Steer in CIDRAP, where she says people think of it as a coin flip. Either you live or you die, and nothing in between matters with measles. But immune amnesia, encephalitis, pneumonia, they're the in-between, and those are important outcomes to measure. If you can avoid having your child go to the emergency department, wouldn't you do that? And just remember, when I talk about the fact that in Idaho, a vaccinated person got infected, a breakthrough case is how they would put that. A vaccine case under heavy circulation, that might be expected. It's not evidence of vaccine failure. MMR confers near sterilizing immunity, but it's not 100%. And the breakthrough disease you have is much, much milder. I want to now move to some of the politics that went on this week. And this has to do with the Senate's confirmation hearings for the CDC director nominee, Erica Schwartz, and the ASPR nominee, Sean Kaufman. So first on Dr. Schwartz. She's an impeccably qualified physician, confirmable under any administration. The hearing left me with a lot of questions and a lot of doubts. For example, she said that she didn't think that the president or RFK Jr. would ask her to do anti-scientific things. That evades the fact of why she's there. That's exactly why Susan Menares, the prior CDC director, was fired for being asked to do anti-scientific things by RFK Jr. So that either strikes me as I think it's intellectually dishonest. There's no other way to claim that you don't know, you don't think that they would do that when they have done that from the very beginning of the administration. She said she's unaware of RFK's vaccine action. That's completely ludicrous. Every physician knows for the past 2 decades what RFK's been doing with vaccine actions. This is evasion, and I don't think it speaks well to her, and I don't think that makes her a good candidate for CDC director anymore. Because if you can't be honest about this or you're evading it, I think it doesn't speak well to your cognitive habit. On Kaufman, who's the ASPR nominee, this is an anti-vaccine advocate. He talked about the fact that he would rather perish than have his children get COVID vaccines. The fact that he used the word perish is, I think, telling, and it really speaks of anti-vaccine sentiment. He blamed it on the fact that he's Generation X and doesn't know how to do social media. I'm Generation X. That's not an excuse. He also supported RFK's cancellation of mRNA biodefense contracts as well. He doesn't understand if he's going to be the one in charge of BARDA, the area of HHS or of ASPR, or the agency that does all of that innovative work with trying to bring these products to market, including mRNA vaccine that was instrumental in Operation Warp Speed. I don't understand how he can be the ASPR. How can he be put in charge of the nation's vaccine stockpiles when he doesn't even believe in vaccines, I think, at heart? And I think there was a lot of wishy-washiness there, but I think at base, that's what you're getting. And at the same time, the ASPR budget request is significant, covering BARDA, the Strategic National Stockpile. This is a genuine positive, but I wonder, how are you going to steer it or steward it if you're going to have all this money but not use it with the most promising candidates like mRNA technology? And Craig Spencer, the emergency medicine physician that had Ebola, he had a really great piece in The Atlantic where he talked about the fact that outbreaks are fought with the infrastructure that's already in place. And I think the infrastructure that needs to be in place is a competent HHS secretary who believes in the germ theory of disease. And short of that, I think we're always going to get in these kind of messes. This is a symptom. The fact that we had these nominees is a symptom of the fact that RFK Jr. has poisoned the entire process. Now I want to move to a counterexample where I think we're starting to see what a working system looks like as a contrast, and that's the Legionnaires disease outbreak in New York City on the Upper East Side. The case count is around 63 with 15 hospitalized, and I think the environmental response has been really aggressive. Dozens and dozens of cooling towers have tested positive. Over successive rounds of sampling, all the positives are being remediated. Effective sites have included things like the Guggenheim Museum, not just apartment buildings, and they're being pretty aggressive and pretty transparent about this. You see the New York City Health Commissioner on television a lot talking through the day-to-day grind of running this outbreak down. They're doing PCR testing of these cooling towers. Just remember that a PCR is not proof of viable transmissible Legionella. It might be dead organisms, so they're going to have to do more studies on that in terms of culture to see exactly what's contaminated or not. And I think what really matters is remediation numbers. How many of these things have been remediated rather than the number of towers that are testing positive on PCR. And I think what you see here is a contrast to what we've been seeing with public health. You're seeing a domestic outbreak now with trained people testing capacity, remediation authority, all in place, being used. Competent public health communication. New York City Health Department is one of the premier health departments in the world, so it's not surprising, but that's how it should be done. A couple of last things I wanted to mention. There is a norovirus outbreak on the National Geographic Seabird. It's the third outbreak that this ship has had. I am someone who partakes in lots of National Geographic vacations. They're one of my favorite things to do. I've been to the Galapagos twice and other places as well. I've never been on the Seabird, and these are smaller ships with not that many people. I'm not sure what's going on there, but I hope they clear that up because I do like that company, National Geographic and Lindblad, that run those. Another story, Lyme disease. I've been talking about tick-borne illnesses being increased or tick visits to the emergency departments being increased. One of the things that's important to impart is that not every tick bite, not every tick carries pathogens. So there was a stat that I wanted to just repeat. So in Pennsylvania, you can send a tick and they get tested. You can do that in other states as well. So 141,000 ticks were sent in by residents of the state, and only 28% tested positive for a vector-borne disease. So that's important to remember that all is not lost if you got a tick bite. And an interesting story about a rabies case in Montgomery County, New York. It was in a horse. A horse became rabid. Seems like there were 5 exposures. People are getting post-exposure prophylaxis. So just remember that other animals other than dogs, cats, raccoons, skunks can get rabies, and horses are one of those. So to wrap up, I think if there's one lesson this week, it's that pathogens don't need to become smarter. They're smart enough. They really just need us to become less vigilant, whether it's contaminated lettuce, Ebola in the DRC, measles here, Legionnaires disease in New York. The deciding factor isn't the microbe. It's the people watching the gate. None of this is self-sustaining. Every generation or every municipality, every person really has to decide whether it's willing to kind of beat back the devil and be vigilant against infectious disease and allow civilization to flourish or not.